Hello, and welcome to the Early Childhood Health Consultation May webinar, Considerations when Caring for Children with Special Healthcare Needs. My name is Maria Morgan, and I'm the project manager with Early Childhood Health Consultation. Our team is so excited for you to be joining the conversation today. Our program is in partnership with the Wisconsin Department of Children and Families, housed at the University of Wisconsin-Madison School of Human Ecology, and funded by the Preschool Development Grant. Our program is committed to support Wisconsin early childhood providers in addressing health-related questions and offering guidance on best health and safety practices. We envision a sustainable and statewide model centralized around health consultation and focused on promoting the health and well-being of children across Wisconsin. The Early Childhood Health Consultation Program acknowledges the American Indian tribal nations across Wisconsin and commits to a partnership to tailoring support and best meeting the needs of each tribal community. The Early Childhood Health Consultation Program offers general guidance on best practices for health and well-being within early childhood settings. Any questions about a specific child should be directed to that child's primary care medical home. For today's webinar, we will begin with a few introductions, have ample time for our guest speakers' central content, offer time for question and answer, and wrap up with a few closing remarks. A couple Zoom webinar reminders. We will have the chat enabled. When you enter into the chat, feel free to enter comments throughout the presentation. You can use the drop-down arrow to send your comment to the hosts and panelists or to everyone. Also, we have the Q&A feature enabled. Feel free to type your questions throughout the presentation today, and you can send those anonymously. At this time, I would like to pass it over to our program director, Dr. Dipesh Navsaria, to talk more about today's webinar.
Thank you so much, Maria. Hi, everyone. Great to see everyone here for our May webinar. So today we'll be talking about how early care and education providers can approach caring for children that have special health care needs, which, as we'll see, is a very wide and diverse array of children. Develop questions that you can ask when you're unsure about what the plan might be around their health needs. And of course, identify that we at Early Childhood Health Consultation are a resource for you if you have health and safety questions. Again, just to remind you, as a bit of framing here, this is a large and extensive topic. So we'll really be focusing on kind of general approaches because there's no way we can cover every single condition out there in great detail. We are thrilled to have a team of 4 folks who have tons of experience in the care of children with complex care needs. And I'll let them introduce themselves as they speak, but they represent a variety of perspectives and disciplines, and I think can also highlight so many of these ways that we can really address the needs of children and families and your centers when they come in with these unique needs. With that, I'll let them take it away.
Hi, I'm Kristan Sodergren, a Pediatric Nurse Practitioner with the Complex Care Program at the American Family Children's Hospital. Our program is designed to meet the needs or attempt to meet the needs of children with very complex medical health care needs. They're the highest utilizers of the healthcare system, but interestingly make up a very small portion of the healthcare system. These children, in order to qualify for our program here, have multiple subspecialists involved in their care, including lung doctors, neurologists who care for brains and spinal cord, as well as GI doctors to help with their stomachs and lower intestines. Next slide. So today, the goals of our time together would be to provide some level of normalization for children with complex healthcare needs. And we really want to emphasize the importance of communication and inquiry and give you a place to start to have those conversations. Next.
Do you want to start first? Poll. Marie, can you submit our first poll question? What is your experience with children with special health care needs. So the options, if you could just select one, that will give us an idea of everyone's experience.
And once you guys have entered your answers there, if Maria could just let us know and we can move on to the next slide. Thank you.
Sure, we've had over 85%, so I'm going to go ahead and end the poll and see the results.
Okay.
Super helpful. Super helpful.
Okay. Yep, this does help us. Okay, great. Thank you. Thanks for sharing that information with us.
All right, so now I'm going to go ahead and introduce myself. First and foremost, I am a mom. I have 3 kiddos, and my oldest son, Jack, was very medically complex. You can see him in the picture there. It's so important, in my opinion, to put a face to disability and normalize, kids with medical complexity and any special healthcare needs. They're just little people, and sometimes it just takes a few more questions and a little bit of curiosity to be able to care for them. So my role is both at the Weissman Center and with the complex care team as a family engagement specialist. And all that really means is listening to families, learning from families, and helping to prioritize the partnership and communication between families and their care teams. So back to our presentation. So kids with special healthcare needs are just kids, they're siblings, they're friends, and they all can be cared for in a variety of different settings, and people with no experience at all can be trained with just a little help and support to care for these kids in just about any setting. Next slide, please. Couple more pictures of my son. So medical equipment can be a scary thing when you think about caring for kids with special healthcare needs. But really, the more exposure you have to it and the curiosity you have to ask questions about it are what's going to help take away that scary part. Wheelchairs, standers, special seating devices, things like that. We'll talk more about that later in the presentation, but just learning about it and asking questions will make everything less scary, and families are more than willing to answer questions about their kids. And I can say that as a fact. Kids do best when they're supported in their homes and in the community. And there are plenty of resources to help learn how to do that in the best way. So families are able to really thrive when they get that support that they need. And part of that is being able to find a childcare setting that's able to watch their child so that they can be members of society and go to work and, have friends and do the things they want to do in their lives too. So it's so important for families to be able to find childcare providers who are willing to help work with them. Next slide. This is a picture of a care map. I don't know if people have ever seen these before, but it's a really cool tool that helps to illustrate a couple of things. I mean, first of all, at the center of that care map is the child. The next circle is the family, and then all the different colors represent the different areas that are involved in caring for a child with special health care needs. And it looks really complicated, but the thing to take away from that is all of these pieces matter. And even if you're just a little circle on the corner of that page, you matter just as much as somebody who represents like an entire color. But the most important piece is it's a team approach. Everybody needs to have communication. All the different teams being able to talk to each other is what gives a child the best care that they need to be able to live and thrive. Next slide, please.
So thank you, Danielle, for discussing all of that. I'm Teresa. I'm one of the nurses in the Pediatric Complex Care Program, and I've been here since the inception. I think to Danielle's point on the care map, part of our role as the complex care team is to try and help the patient and family get connected to all those resources, or help ensure that those resources are being utilized to the fullest extent so that we can support the patient and family to the best of our abilities. So that care map is really important. Here are some common technologies that you might see a kid come into your school with. Some of the more common ones are like G tubes or G buttons. NGs and those things aren't as common, but G buttons are nice and handy now. They're not as bulky as like like a peg tube, where that used to be like a disc with a long tube hanging off it. They've really compacted the size of the G buttons now, and those are really almost skin profile. So G buttons are some things that you might see. Some kids with medical complexity might come in with a central line or a port. Also like tracheostomies and ventilators, things like wheelchairs, pulse oximeters, oxygen, BiPAP or CPAP. And we don't need to go through the whole list, but really just to talking to the family about what is the technology that the child is dependent on, you know, what kind of things have you seen with this child and some of the issues that you might have seen with the technology, maybe some of the troubleshooting that you might have to do with them. And so really, you know, bottom line is talking to the family about whatever that technology might be, and just getting to know what's normal for that child, because every child is different and the technology might be something different for another kiddo. So just getting yourself familiar by talking to the family, you know, and also other people on their care team can be helpful resources for you as well. So if you work with the family and they feel that it would be beneficial for you to get further education with their healthcare team, you know, getting a release of information to talk to their healthcare team might be a good way for some additional education that you might need for some of these technologies to feel a little bit more comfortable. Next slide. So I don't know if I was going to share a story here, but I think, you know, part of what our role is in the complex care team and part of the story here is just to say that there's people all over in the community that are maybe not scared, but definitely not as comfortable with some of the medical technology that some of these children are now needing to come to daycares and schools with. And I really think just working with the team. So interesting story. A month or two ago, I got a phone call from a school nurse saying that the mom had brought in like this extra catheter to be put in place if the G tube were to fall out. And I said, yeah, that's great. That's what we instruct all of our families to do, to keep that hole open just in case, so that that hole doesn't close up on them. And, you know, it's just like a regular catheter. We call it a red rubber catheter only because it's red, but it's like any old other catheter that you would use for like urinary catheterization. So it's very flexible tubing. And she insisted, you know, like, I really need a video or some educational materials on how to put that catheter in. And I said, I really honestly can't provide you with any education, because it's really just like taking the tube, putting it in 1 to 2 inches and taping it in place. That's all it is. You're not going to hurt the child. That tube's been, you know, that track's been in place for a long time. And so you're not going to hurt them. And honestly, that's all they needed to hear from me. I think that the whole search for additional training was more just to get more comfort with that piece of equipment. And so after we talked it through and I reassured them that really, you know, they're not going to hurt the child by doing that, and that there was really no effective training and that was what to do, she felt more comfortable. I think she just needed to talk through that. So definitely just staying connected with the care team. So back to where to start, and we've talked about this already, is establishing a relationship with the parents and the families and the main caregivers for the child, trying to figure out what's normal for the child, what's not normal for the child, what does a good day look like, but what does a not so good day look like? Does the child tend to get their medications in the morning and then fall asleep for a little bit after? That's important to know for somebody taking care of the child outside of the home, to know, is this a normal thing or is this a concerning thing? So just having those communications with the family about what a good day looks like, what a bad day looks like, And how do we help this child on some of those bad days? What are some of the interventions that we can do? Also having a discussion on true expectations. What does the family have expectations for of the school or the daycare setting? And maybe that's not what you guys would expect. And so I've actually had to play that role before as the nurse, helping the family and the daycare or the school come to like a consensus on what's reasonable to expect a daycare or school to take over. And so again, just talking to the patient or to the family about what's reasonable and then working together. And then if you need to get other people involved, just asking the parent for permission on that. I'm going to pass it over to Kristan because she can talk a little bit more about some tools to support the care that you guys might have access to, such as care plans, sick day plans, or crisis plans. Next slide.
All right, Kristan again here. So again, coming back to our theme of communication, which can come both in that verbal interaction that you have with families and with the children, and hands-on approach, but there also might be written documentation that can be helpful for you to have as a resource. One of those things is a care plan. With children that are in the complex care program, we create something that's called a care plan, and we do those every 6 months and they're updated. I like to tell families that this is a living document that changes as we all get to know each other, but also as the family and the child changes over time. These care plans are used to address your child's health and healthcare issues. How do you address problems if should they come up? What are family strengths and preferences for how a child is cared for? And what are the child's strengths and preferences? And they'll have other additional information. But that's just one thing that we create. And you may find that, and I have often found, especially when we bring in new children to our program, that families will come with their own version of a care plan from the get-go. So oftentimes when children do have some level of complexity, families recognize this, and for their own well-being, in an effort to organize their thoughts and their cares for their child throughout the day, and knowing that they'll be handing off their child to other people within their community or even within their family, what's our little toolkit look like, and how can I help those people care for my child? So whether they're in a complex care program is one thing, but oftentimes you'll find families will have something already in place themselves. And if they don't, that can be something to partner with them of what you feel is important, what they feel is important for everybody to know about. So it's just really a matter of asking, what kind of, written plans do you have that could help us, learn about your child. You'll also find these sorts of things with like the individualized family service plan through birth to 3, which Kara may be able to speak a little more specifically to as we move along.
Next slide, please. Thank you.
The other piece that we work on developing are crisis plans, and you may be familiar with something like an asthma action plan where people have the red, yellow, and green zones, and that tells people in your green zone, this is what a good day looks like. I'm healthy, I'm otherwise doing well. These are the medications that I may take. This is what activity may look like. Yellow zone, they're starting to get sick. This is when I start my albuterol inhaler more frequently, add additional medications. And then the red zone, like when do I need to make contact with my healthcare providers? So similarly, there are plans such as this that will help work with families on a whole variety of issues. So whether it's related to the tube coming out, like what Teresa was talking about with the G tube or other types of tubes, if they're constipated, if they're having problems with the feeds that they take either through a tube or even if they take something by mouth, how do you help to intervene? And these are additional plans that families may have already crafted themselves or that they may have worked with their healthcare provider on. But it's really a step-by-step approach on how to kind of work through some of these problems and challenges that you can come up with, and they can be a really nice tool to use. So next slide. All right, so questions to ask. I think this is where we were all talking, like how do you start the conversation? And we all have different ideas on this. An example that I can give, my sister is an elementary school teacher, and that area of communication of the good day, bad day, And even, you know, what's your weekend like? She has a child in her classroom that honestly, she doesn't have to do any of the care pieces of it because this child has a nurse that comes along with her to school, but she would be interested in knowing, you know, what is the G-tube use for? How do they operate it? Just so that the other children in her classroom, if she needs to explain anything to them, and can help normalize it there. But at the same time, the child came to school one day and was really sleepy in the morning and had just found that like throughout the day, they were more tired than on a typical day. And the next day was talking with the nurse and the family about this scenario. And they're like, oh yeah, their grandparents were visiting over the weekend. And this is something that can then make her more tired during the day. So that's good information, and where that communication is important. So asking families, you know, what is your preferred way of communicating? Do we have a notebook that goes back and forth between school and home? Do we just do like a warm handoff each day? That type of thing. But then as you can see on our list, there's many different topics for discussion that are super important to kind of ferret out depending on what your center looks like and what the needs of the child might be.
And just if you guys aren't familiar with a medical home model, that's one of the items on this slide. So a program like the Pediatric Complex Care Program would be like a medical home model. You know, primary care doctors' offices can be a medical home, but, you know, sometimes they need a little bit more support than that. And so, you know, that just might not be something that they're even sure what you mean by when you ask that. Is just kind of a more robust support system there. And then also for a to-go bag or go bag, that is something that the children that we take care of that have like tracheostomies tend to have. So when we send a child home with a tracheostomy, we kind of get the family prepared for like, what would you need to have on you in case of an emergency? And they always carry that bag with them all the time. So just another good question to ask, is there anything that they have like a go bag or anything that needs to be on them at all times, what's in there, and kind of just talking about what's in there and how to use it.
I think the only thing I would add is, you know, any daycare type setting or a camp or even school, there's an intake packet, right? I mean, there's lots of questions that you ask any parent about any child about care preferences. You know, what is their typical toileting habits? What are the methods of consoling a baby? Things like that. So thinking about that, but then just adding another level for some of these kids with special healthcare needs. Maybe there's a child who's nonverbal or non-speaking. You would ask the family, you know, how does your child tend to communicate? Obviously, every child is capable of communication, even if they're not using words. So what are the things that you would be looking for? That's just one of the examples I like to give, because communication preferences will vary, and it's important to think about those kinds of things as well. I think that was all for that slide. Next slide.
I think we can all jump in. We wanted to provide a few pictures of some of the more common technology that you may find. The picture with the little baby that has what looks like a button above their belly button. That would be a G-tube button for feeding, and that gets connected to longer tubing, similar to what's in the backpack adjacent to it with the syringe. There's different positioning types of tools, standing frames, wheelchairs that go from a sit to a stand, that provides normalization and socialization. That's super important for kids. It allows them a child who may spend the bulk of their time really in a seated position or even a laying down position to be at that level of their peers and have that interaction. And then there are different communication devices as well. Anything from super advanced eye technology where children are able to blink their eyes on certain pictures if they look at it long enough to create sentences, words, or preferences, to iPads where they can touch the pictures, to the little cards that they can choose and put on a Velcro pad to express their needs, wants, and desires as well. It's not so scary and kind of fun to play with.
Yeah.
Next slide. was buttons, yeah.
Oh, okay. So I think we've talked about this a little bit as we're going through the presentation. And actually, this is probably where I was going to share that example, but managing expectations with a family, especially if it's your first time as like a center or daycare provider, to know like what is typically expected of like from a child of a family with special health care needs. Is what they're asking reasonable? Or, you know, sometimes when people just don't know where to start because they've never encountered it before, it is helpful to like talk with some other folks. So I think like kind of back to my point before is just working with a patient and family to really determine the expectations and make them so that everyone's on the same page, but also just if needed, including additional members of the healthcare team, you know, per parent's, you know, permission, of course, but just to like really get everyone on the same page to make sure that their needs are being met.
Next slide, please.
Oh, and sorry, just one more thing on the communication is there are releases of information if you were to want to share or speak with the members of their care team. The parent and family would definitely need to sign a release on their end of things for you to be able to talk with some of the members of their healthcare team, but that is not out of the realm of possibility. So I just wanted to make that a note as well. Next slide, thank you.
My name is Kara. I'm a social worker that has a privilege of being on this team of complex care providers. So my primary role in all of this is helping families find care that is inclusive and that they feel comfortable sending their child to. And so I thank all of you for joining this and trying to learn more. I know how difficult it is personally, just even to find childcare in general. So I really feel for these families and for you all of being in the spot that I know you're short-staffed and all of that, just to learn more from us about how to include children with disabilities in care. I listed some of the benefits of inclusive childcare specific to the child as, you know, they are able to have their peer interaction and prepare for school and learn the skills to be more independent. But probably the biggest one is giving the parents a break and the ability to work. You know, if a child, if they're able to find care, then a child, you know, it doesn't have to come down to a one family income, which just makes everything more challenging and difficult to manage if one parent does have to stay home to work or stay home to care for the child if they can't find childcare. So and then, you know, the things that families are looking for in a center is, we often get the question of, do you have any recommendations of inclusive childcare places or people that are the experts in this, you know, with children with special health care needs. And, you know, we just tell families that it is inclusive. And so it's just like at school where they have to train all the people around them on their care team. It would be the same type of situation for childcare. So again, it's really just preparing them for that next step when the child goes to school. But they're looking for the same things that any family is looking for high quality childcare. And I think just stressing that communication is probably the biggest and most important aspect of all of this is like, how does the center communicate with us as parents? How do we know if something comes up that like an emergency, but like also just the day-to-day communication and comfortability with the care and all of that. And then also just the environment. So to make sure that they have the accessibility needs of the child if they're in a chair or anything like that, like the physical environment.
And just to add to that, I think another piece with you guys in the early childhood system, you don't have probably access to like nurses like schools do. So, I mean, I definitely think talking to the patient and family and asking them if they have a nurse resource to use for education, if the, you know, if the family's not comfortable or if somebody at the center, there's always somebody else that you can ask that might be able to help with some education, or there might be video links that somebody on their care team can send to you guys as providers to learn how to do things too. So just keeping up that communication.
Yeah, that kind of brings
Next
me
slide,
to the
sorry.
next slide. Yeah, no, thank you. I know we previously talked about like managing communication, and that was a piece of it that Teresa touched on. That there's often, I mean, like as you saw in the care plan, there's a huge team of people that support these children. So it's just, I think, tapping into those resources we really encourage you to do, especially if something seems off, like if the family might be under, you know, like not communicating enough about the needs, or the opposite, that they're having maybe unrealistic expectations of what the center would provide. That's really helpful when, you know, you can tap into another resource that they have in the community. So one of those people could be the service coordinators for the children's long-term support waiver. I work frequently with them, and they're amazing in helping kids that have the waiver. I should back up. It is a Medicaid waiver program, so not every child that has Medicaid has this benefit, but it is an additional support to Medicaid. It typically covers things that insurance doesn't provide, like respite care and adaptive equipment, all kinds of things. But they are assigned a service coordinator as well. And the goal of the children's long-term support waiver is to support children in their communities. So they're really focused on doing whatever they can to make sure the child is successful in the community. So I think childcare in that type of setting is a really good use of, you know, how they can help. They do develop an individualized service plan that, like Kristan mentioned, with birth to 3. So that's just based on like the goals that each family sets for the child, and the child, if they have the ability to communicate like what kinds of goals they have. And then the service coordinator then provides services and fundings to reach each of those goals. And like with birth to 3, it's how they divide their services. So birth to 3 can provide, you know, physical therapy, occupational therapy, and speech. So it just and it would be beneficial to have a copy of those so that you can see what the goals are for both the children's long-term support waiver and birth to 3. We just wanted you all to know that it's a tool that you can ask for a copy of, just to help understand as well, like what services they get and who all is involved on their team.
And to clarify too, the waiver program is something that's available in each county. And so it's not specific to any one location within the state. So certainly feel the freedom to ask if that support is provided for the child.
Yes. Next slide, please. So where can you learn more? The best resource that I can give you is the Children and Youth with Special Healthcare Needs Regional Centers. There's 5 throughout our state, and they are the hubs that are specific to each area that can provide specifics about what's available in your area. So if something comes up that we are made aware of that we're not sure, we always turn to the regional centers. You can call them. They all have websites that are listed, but there are informational referral specialists that answer those calls and can point you in the right direction. So it's a wonderful, wonderful resource. If you don't take away any other resources, this is a really good one to save, because they kind of cover everything, and definitely know where to start. So next page, please. Some other additional resources that I wanted just to mention is the Wisconsin Department of Children and Families have a wonderful toolkit that I found on their website specific to inclusion. So I listed the link there if anyone is interested in looking through some of that information. There was also tip sheets about laws that protect children with special health care needs, child development, tips for providers about how to handle challenging behaviors, and even like program strategies on what a child care provider would be able to do. Family Voices of Wisconsin is an advocacy group. They have a resource library that covers probably any topic that you can think of. But they have fact sheets, they have videos, and all kinds of toolkits. There is a specific one to inclusion that they have on there as well, as the Children's Long-Term Support Waiver, and many, many other items. So that's just a plug that they are a wonderful, wonderful resource. The Well Badger Resource Center is a database of resources that are specific to children, youth with special health care needs. So it's similar to 211, if you're familiar with that, but it covers things from like where to send kids for health information, but also like government benefits, really anything that you could think of as well. So they're another great resource. And then I put on here that there is also some other funding resources that are out there as well. There is additional funding through the Wisconsin Shares Child Care Subsidy to support children with special needs that they could be eligible for an additional amount that they receive through the Wisconsin Child Shares. And then CLTS also has funds that they can use to help support children to be included in their childcare environment. So those are in the community, Children's Community Option Program is also county based, like CLTS. So it would be similar to that. I don't really know how to explain that better.
It would be going through the county, so the best
the
bet would
county.
probably be going through the regional resource centers to access those types of things.
Yes. Yeah, just to know that there are other funding supports out there, and that CLTS can help put in additional support if needed and help with training and all those kinds of things, funding wise, to make that happen. Next slide. So we just wanted to thank you for all of your hard work and dedication to supporting children with special health care needs and their families. And then we have this little quote that I liked, when you can't change the direction of the wind, adjust your sails, which is just always a good reminder for all of us.
Yeah.
So thank you so much for listening. And then we can see if anyone has questions.
Thank you so much for that wonderful presentation. It was really a delight and was so helpful. And I love that ending quote, because the other thing to remember is that we're all able to adjust ourselves. Maybe it takes one or two of us, or maybe it takes a lot of us, but these are differences that we can make. It's not impossible. And hopefully folks feel a little bit less anxiety about having children and youth with special health care needs in their charge, or feel like they're more able to be inclusive of them when those questions come up. So again, please put your questions or comments in the chat. I'm seeing a ton of appreciative thank yous appearing in the chat. So thank you so much for that. I do see okay, there was a question that was about the regional centers, and thank you. The link was placed there as well in there, and I'll go ahead and make sure that I also put that in the chat. And we will, of course, make all this information available to everyone, and you may see some of these things appearing on our resource library on the web as well. I see a question about credits and other things. There'll be a survey in a few moments at the end, which you should fill out in order to get credit. Questions for our guests? I'll give folks a moment to think and type. I'll ask our guests while we're waiting for some people to think about what they might have to ask. If there was one wish that you had that would make the lives of children with special health care needs and their families smoother in terms of interacting with the early childhood community, what would that be? What do you think is within the realm of possibility that could make things better for them?
I was going to say Danielle.
I figured. I mean, I think that's a question that would go back to just normalizing disability a little bit. If you can just approach things with a little more curiosity, and it's easy to spiral when you think about special health care needs and disability. It's just like this big scary thing, and there's no way any one person can know everything they need to know. But if you have that curiosity and you just focus on that one kid and that one family, it makes it so much more possible to develop a relationship and have good communication. And so much is possible when you have that solid foundation.
Thank you. That's really appreciated. And I'll even say, like, as a pediatrician, if I'm seeing a patient for the first time that is a child with special health care needs, even with all the notes that I might have available in front of me, I often don't know some things like, how is this child able to communicate? Is there communication that I can easily see or hear or receive in another way? Typical for them or not, right? And that's where I turn to the parent and ask them, I've never met your child before. Can you help me understand how normal or unusual this is for them? And we shouldn't feel ashamed of that, or that we don't know that. There's a question in the chat here about how can you make a parent feel comfortable with having a child care teacher care for a child with healthcare needs. I work with a non-mobile child and the parent is always on edge, which is fine, but I want her truly comfortable. What sort of advice might any of you offer?
I had that happen quite a few times, and I think we've seen some parents where, like, wow, they don't understand how much they can trust others until they've had that situation. So I think the first barrier is likely that mom or that parent likely hasn't needed to have somebody else care for that child, likely, and that's why there's that level of like anxiety along with it. So I think just communication, the curiosity, like, I really want to know what's specific to your child. And then we've had parents feel better by being like a fly on the wall. So I know it's not always acceptable or like ideal to have the parent in the childcare setting, but sometimes that's what you need to prove to the family you're doing a good job to take care of them, because they do need to gain that trust if they've never gained that before with anyone else. And so it might be, I had a family who like for a day or two was in the classroom in the back, like quiet, didn't do anything, watched, then was like in the hallway for a day or two, kind of just still being there, you know, maybe in like another conference room for the day, like just, and that was more for them to get the comfort, not for the school. So I think acknowledging that maybe they haven't ever had to trust anyone before, because that's a big step for them, being curious, asking questions, and then maybe inviting them in to like see what you guys do and how you take care of them might ease their troubles.
I was also going to say, you're not alone, as those of us who take care of the children in the hospital setting, where you would think that sometimes we have a little bit of a clue, but oftentimes we don't have all of the answers and clues on how to care for all of these children, as they have very unique needs, that we are oftentimes in a very similar situation. And it really is a lot of that back and forth communication of how do you do this at home, and how can we either replicate that here, or if we can't, what's kind of a happy medium that we can come to that would be acceptable.
And I see someone put it in the chat, and I think that really is the main point, is that it's just building relationships, and building that trust and rapport is really how it happens over time. But you know, it's hard for on both sides, both the provider and from parents. So
Thank you. If I can offer kind of from some of the work I do academically, what we're talking about here is a concept called relational health. What is the health of relationships? And that's not just a relationship between a child and their parent, whether the child has special healthcare needs or not, but also the relationship between all of you caregivers and the families that you work with, the child, and so on. And we as clinicians in our various disciplines also should be thinking about the relationships we're forming and how we can do that better. So it really does all come back to relationships ultimately. There's a couple of questions that are asking about resources and complex care, like specialty early care settings that are better equipped and trained to deal with some of the more complicated needs. Do you have thoughts about how feasible that is, or whether there's needs for that, or how that might happen?
So I think I get that question all the time. Is there a specialty childcare setting? And that's kind of what I was referring to, that we don't know of any. There are some centers that just have more experience just because of, you know, the children that they've cared for. But really it's inclusive. So there is no specific center that we're aware of, if you all know of any. But there is supports to put like to make it inclusive. So here in Dane County, we have the child care inclusion program through RISE, where they can send a worker out to the centers to help with training and just kind of be that medium person. I know that doesn't exist in all the counties, but that's where we can kind of tap into the other supports that the family has to see if it's not through the child care inclusion program, is there a service coordinator or like a physical therapist, anyone that can come out and help do some of that training and building that rapport and doing some of that along with the family.
Yeah, thank you. And along those same lines, sometimes the issue is resource limitation, right? That, you know, if if there was big money in early childhood education, right, then there'd be 1 billion of them and all in beautiful mirrored glass buildings. And if there was big money in caring for children with complex healthcare needs, there would be about 8 billion resources out there, right? How do we help in the reality that we're in to convince, administration or others that yes, inclusion, comes at quote unquote a cost, but it's worth it? As are there strategies that you found work or make a difference there?
I think the only strategies that I've seen that works is really communication, like getting the, like I said, for that instance where the nurse, and this was a school setting, but still the nurse was not comfortable even just putting that catheter in and taping it in. So if she's not comfortable, the people that she's going to train are not going to be comfortable. So tapping into those resources, like her calling me and just reassurance that like, you're not going to hurt that child. This is, what you can do. I think really that communication and tapping into the resources, because I think what we tend to do with children with special healthcare needs is we as providers, not maybe necessarily me as a medical provider, but on the childhood care side of things, I get so scared that I don't know what questions to ask. And then I just kind of don't ask any. And I expect the family to just like tell me everything. But we have needs as providers. Like, how do I need to know how to take care of your child for a whole day? Like, what do I need? And so I think that's the thing that people get scared is they just see a child with special needs, get scared, kind of don't know what to ask, expect the family to like tell you everything. And that's not the ongoing communication and like, who else can we ask to help with this resource? Who's on your team? Who knows your child that we can pull in? So yeah.
And I think from an advocacy level, I mean, there's always, like we say, go back to the state. I will say, like, we have, as part of our program and its inception, we had a very close working relationship with the state of Wisconsin and Wisconsin Medicaid, and continue that relationship with feedback that we'll hear from our families where there's a barrier to receiving some form of care that we all feel should be covered and out there and acceptable, to where we can give that feedback to the state of Wisconsin, like, hey, this is a deficit that we're seeing. So the more we hear about those sorts of things from everybody in the community, those are things that we can, take back to people. But you're right. I mean, unfortunately, while children are kind of the foundation of where we're going up, they seem to not get the funding to build up.
Indeed,
That's just the advocacy piece. You can't stop talking about inclusion and the importance of inclusion and how the benefits really are for everyone. Inclusion doesn't just benefit the child with a special healthcare need or the child with a disability, and there are no negative effects to exposing typically developing children to peers that have special healthcare needs. And honestly, until you're faced with a situation where that impacts you in some way, either professionally or personally, people just don't think about it. It's really, you can't underestimate the power of just sharing that education with others. And if anyone, working with kids shares that information with the next level administration and et cetera, that's what it's going to take to get more centers that can provide adequate care for kids with special healthcare needs.
Yeah, we're definitely all worse off when we don't include a broad variety of individuals anywhere in our society, and I think I really appreciate that frame there. We did not get through a few of the questions. If there was a specific question someone had that they would like to follow up on, please don't hesitate to contact us, of course. But thank you so much to our guests for all this amazing information that they shared with us today, and to folks for attending. And I will turn this back over to Maria to close us out.
Great, thank you. Just as a reminder, our program is called Early Childhood Health Consultation, and we are here to answer your health and safety questions within early childhood care and education settings. In addition to our monthly webinar trainings such as this, we also have an on-demand resource library, which can be found on our website. And also we have tailored health consultation, which is in target locations across Wisconsin. We're excited to announce our expansion of additional health consultation service locations. More details can be found on our website. We'd also invite you to subscribe and listen in to our podcast, Teachers, Toddlers, and Tissues. Episode 3 is launching next Wednesday. Additionally, on the screen, you can find various ways to contact us: phone call or text, email, website, and also on social. We'd like to say a special thanks to the many early childhood care and education providers who offer ongoing guidance to help us best meet the programs and communities they serve, including our very own advisory board of ECE providers. We'd also like to thank the child care health consultant programs across the United States, our current project partners, and our past project team members. Following today's webinar, a few quick reminders. At the end of today's event, you can check out in the chat a post-webinar Qualtrics survey link. This is a great place for you to enter your information if you're interested in continuing education credit with the Wisconsin Registry, and feel free to share feedback for us to improve our future webinars. Following the event, you will receive a follow-up email with a link to the recording as well as a link to the Qualtrics survey. And then a couple of weeks following the event, any of those who've entered their information on the post-webinar survey for registry continuing education credit, all of those attendance details will be submitted directly with the registry. Also, you can check out our webinar recording available on our website. We invite you to also save the date for our next webinar. You can check out more information on our website. Okay, so at this time, I invite you to look into the Zoom chat. That is where you will find the link to the Qualtrics survey. And with that, we'd like to have a few closing remarks by Dr. Dipesh Navsaria, our program director.
Thank you again so much, Maria. Again, this is such an important topic, and it is indeed, as we heard, a large and sometimes complicated one. But I think the message that I'm taking away, and I hope all of you take away, is we shouldn't be frightened, that by asking good questions, by building strong relationships, and by really just being curious. I love that. Being curious about what this child and this family's needs are, everyone will feel better. So thank you again to our guests for sharing those wonderful pearls of wisdom with us. Thanks, everyone, and thanks for all that you do.